The 4 West Interdisciplinary team is always intentional about compassionately caring for the whole person in their life journey at the Misericordia Hospital. One example is with an ALS patient. Team members worked with him to write and produce a song documenting his experiences with ALS. He also loves going to the movies. The team was able to arrange a trip for him to enjoy an afternoon at the theater. And when his brother passed away, they were able to help him go to the funeral. The team not only provides quality care, but also engages the patient in what quality of life means to them personally, so that they can achieve those personal quality moments.
It's just another day with my struggle with ALS.
At the Kilom Health Center, Kelby's passion for rehab and compassion for others lends itself to her quest to improve the residents' physical, social, and emotional well-being. She has implemented many therapy programs, from chair yoga to Zumba, and initiating spa days and scavenger hunts. When Kelby heard that residents were feeling bored and lonely while waiting for breakfast to be served, she responded by creating a morning coffee group for residents to connect. Kelby's contribution to developing additional rehab programs and caring for the residents demonstrates her compassion daily.
Marie is a living example of compassion towards both patients and colleagues at Banff Mineral Springs Hospital. Marie cares for her residents, usually anticipating their needs and helping before being asked. She has participated as a member of the Enhanced Dining Experience Committee that was tasked with developing a more respectful way to offer meals to the residents of St. Martha's Place. Marie knows the residents well and was able to identify which residents would be able to take advantage of the new service. She also suggested an alternative way to serve those residents who were unable to articulate their choices so that all of the residents would feel respected and valued.
Marlene carries out her duties with sincere compassion at Bonnyvile Health Center. Her calm, serenity of spirit, and attentive listening helps build trust and a caring relationship between staff and Indigenous patients. Marlene has taken it upon herself to give extra attention to a long-term care patient who does not have family nearby. Marlene is able to interact with her in her native language, Cree, which makes the patient feel at ease and comforted. Allowing the Indigenous communities to follow their time-honored traditions and ceremonies is only one way that Marlene shows compassion every day.
Commitment and compassion are just 2 words used to describe Marianne's personality at St. Joseph's Auxiliary Hospital. One way she demonstrates compassion is a storeroom she cleaned and filled with clothes to be distributed to residents who may need them. She uses tact when gifting these items, so the recipient never feels embarrassed. Marianne also makes a conscious effort to acknowledge residents in the hallways and stops to chat with them. Marianne is appreciated by her coworkers, the residents, and their families for the compassionate care she always gives.
Known as the Auxilians at Mary Immaculate Hospital, this group of volunteers provides comfort, kindness, and a feeling of belonging to the residents. The volunteers demonstrate compassion through meaningful gifts at Christmas and birthdays, weekly bingo afternoons, and planting flowers. They have also fundraised for major equipment such as a handy bus. With their comfort cart, the group provides support to patients who are facing end of life. The residents and patients of Mary Immaculate Hospital feel loved and cared for because of the compassionate care the Auxilians provide.
Megan displays compassion daily at Uville Home. She constantly promotes teamwork by supporting, assisting, and mentoring fellow staff members. She also shows compassion to residents by using pet therapy to help lift the spirits of residents. An example of Megan showing compassion through empathy was when she skipped her lunch one day to repair a sentimental, broken coffee cup for a resident. Her caring, compassionate attitude is infectious and brings a welcome sense of lightness to the unit.
It is in compassion where Michelle excels in everyday patient care at the Grey Nuns Hospital. Michelle is always present, thoughtful, and engaged about the care that is being provided to each patient. One patient who is at end of life wanted to be home with his family. Under short notice, Michelle went above and beyond to arrange air transport with very little cost to the family. She also provided a care package at Christmas to a young boy who is about to lose his father. It is through her example of compassion that she inspires the rest of her staff to attain the same standard of care.
Every day, the Edmonton General Continuing Care Spiritual Care team lives their compassion to the deepest level. Upon seeing a newly admitted resident sinking into depression, one of the team members found out that she was missing shopping at the market. The next day, the team member brought the resident to the seniors market in the basement so she could go shopping. She was simply amazed, and there was a positive change in her demeanor. This team does so much for many because they love people compassionately in all they do.